I'd like to start the talk today with a case. We're going to imagine that we're seeing a 45-year-old woman who developed a blood clot after a 7-hour flight. She's otherwise healthy, she's up to date on age-appropriate cancer screening, her laboratory studies are normal, and she's initiated on anticoagulation. Now you see her 3 months later after a pretty uneventful anticoagulation course. And my question is, what do you do next? Do you continue anticoagulation? If so, what agent would you use and at what dose? Or do you discontinue anticoagulation? Or do you obtain additional information? So when we're talking about extended anticoagulation or secondary prophylaxis, what we're really doing is we're thinking about the management beyond 3 to 6 months. So when I treat blood clots, I really like to think of it as two different phases. There's the acute phase, which is the first 3 to 6 months. And in that phase, my goal is to try to prevent that blood clot from causing further trouble. I want to prevent the blood clot from getting bigger. I want to prevent the blood clot from breaking off and going somewhere else in the body, such as causing a pulmonary embolism. And I also want to prevent whatever caused the first blood clot to occur to cause a second blood clot somewhere else. Now, after 3 to 6 months, one out of two things can happen with that blood clot. Either the blood clot can completely resolve and there's no evidence of further thrombus anywhere in the body, or the thrombus can become what we call organized or a chronic thrombus. And what happens in that situation is that the blood clot kind of gets hard and stuck to the wall, and it doesn't tend to grow anymore, and it doesn't break off and cause a pulmonary embolism. So once patients are 3 to 6 months out from their original thrombotic episode, our goals change. We're no longer treating whatever blood clot is left, we're really preventing a second or a third or a fourth blood clot from occurring at some point in the future. This is what I usually refer to as the insurance policy stage for patients.